feel like society is very conflicted when it comes to what women should look like. They want you to be pretty, but you can't be too pretty because then you're intimidating to other women. You could be a little bit curvy, but don't be too curvy. And if you're skinny, don't be too skinny. And I want my daughter to see her mom as fearless. She didn't care that she didn't have breasts. She was still beautiful and did all these inspiring things. Hi, my name is Kiana Wooten, and I was diagnosed with invasive ductal carcinoma at the age of 34 in 2019. I grew up in a urban type of area, New Brunswick, New Jersey, with my brother Chris, my mom, my dad. My relationship with my body growing up was a love-hate type of relationship. I was usually on the thinner side, but with that came a lot of stigma. So growing up, I was teased a lot. I was always called, like skinny mini, which doesn't really seem hurtful, but when you hear it a lot, it just becomes like, I kind of don't like that. And for a while, I thought that there was something wrong with me. I was very conflicted about what my body should look like and would people be accepting of the body that I have, and why aren't they accepting of the body that I have? Why am I not accepting the body that I have? My boyfriend and I at the time, who happens to be my husband now, were trying to conceive, and we had 5 miscarriages. It turns out that I was diagnosed with something called PCOS. So here's like another aspect of my body doing whatever it wants to do and not being this feminine type of body that I wanted. It really messed with my confidence a lot. Even though I had this boyfriend that loved me who didn't really care about those things, it's like, but I care. I see other beautiful women. They don't have hair on their face. They don't have hair like on their chest. They don't have hair on their stomach. So what is wrong with me that my body isn't good enough? I didn't realize how common miscarriages were, but it was the continuation of having those miscarriages that really made me question my womanhood. Like, if I can't do this one thing that women have done since the beginning of time, what good am I? And when we finally did get pregnant with Jordan, we almost lost her again. I was about 4.5 months pregnant, and I passed out and fell on my stomach. And I had to be on bed rest for the rest of my pregnancy because I just bled. It was the worst experience for me because every little movement, I was scared. I'm like, oh, if I move too much or if I, walk too much today, something may happen to my baby. So when I finally gave birth to Jordan, it was like the greatest feeling, like my miracle baby, because for so long, we had wanted her. Seeing her face and hearing her cry for the first time, and I was like, oh, this was the moment that I've been waiting for all these years, like the love of my life, honestly. So in 2019, just doing a routine breast exam myself, I found a lump underneath my armpit. But I really didn't think too much of it because when I was younger, every time I would get my menstrual cycle, I would develop like little cysts and lumps all throughout, like my breast area. However, I noticed that the lump didn't go away, and I could feel it more towards like my nipple area now. And I'm like, that's a little strange. I never felt that before, but once again, me being naive, I didn't think that I was old enough to get cancer. And I'm a chef, so I work a lot with my hands. I'm lifting things up all the time. I noticed that it became harder to do that, became sore, and my husband was getting kind of concerned. He's like, you've had this lump for a while. Now, remember, this is my first mammogram, so I'm thinking this is all kind of just standard procedure. And she told me I can get dressed and that the doctor would be in to talk to me. So I'm like, whose doctor? Because my doctor is not here. And he's looking at the images, and he said to me right there, while I was by myself, you know, I'm about 99% sure this is some form of cancer. He probably said a million other things, but that's all that I heard within that time. And I'm like, wait, what? I feel like the decisions were kind of like just being thrown at me. I was not included in my decision making. It was kind of like, okay, we're gonna do this, we're gonna do the surgery, then you'll do chemotherapy, and we'll put tissue expanders in, and then from there, then you get your implants. And I wasn't, I guess, in the right frame of mind to really do my own research about things. If I had been more diligent about doing research, I probably wouldn't have got the implants to begin with. I developed sepsis twice from the implants. I'm like, I have a weakened immune system. Now I have sepsis because of these implants. So they took them out, put new implants in. And a month later, the same thing happened. I developed sepsis again. So essentially I had like 4 surgeries back to back to back to back. So it was presented to me in a way as like, you know, you're young, you're married, you still want to look like, you know, a young lady. And that was embedded in my head. You know what, you're right, because if I don't have breasts, my husband's not gonna love me. And sometimes that does happen, so I'm not trying to say that it doesn't. Unfortunately, some people don't know how to handle things like that. And I don't think it's necessarily because they don't love the person, it's just because they're scared. And change is scary. So being a chef, a woman chef at that, is just hard in itself. Now, you throw the cancer aspect into it, it becomes a totally different dimension because of the multiple surgeries that I had and chemotherapy. I developed neuropathy. So neuropathy is basically nerve damage, so I don't have a lot of feeling, and the feelings that I do have are pain and tingling, and it makes it really difficult for me to do my job. There are times where I'm trying to grip the knife and the knife just slips out of my hand, which can be very dangerous. People look at me and they're like, well, you know, you look great. And I'm like, well, what I look like and what I feel like are 2 different things. And that's all because of cancer. My legacy means to me that I don't want women to have to go through the things that I went through. I want them to be able to make their own decisions, informed decisions about the treatment that they want, what they don't want. If they want reconstruction, fine. If they don't want reconstruction, that should still be okay and not have to be looked down upon or feel like less than a woman. Today, I love me, like me completely as a complete person, not as Kiana, the breast cancer patient, not as Kiana, Jay's wife, not as Kiana, Jordan's mom, but just as Kiana. I'm Kiana Wooten. This is my life, and this is my legacy.